Hi, my name's Tony, and I'm one of the doctors from the eye clinic, but I'd like to spend a few minutes of your time talking about measuring vision here in the emergency room. One of the most important things I'd like to talk about today is this device, which we call a pinhole occluder, which helps us measure someone's vision. Let's first talk about how to take the vision of just a typical patient that you might see in the emergency room. So let's take the vision of Nora here. She's another Health Partners employee, and she's going to be a model patient for someone who's got a red, painful eye. So she comes into the emergency room, she's not doing well, her eye's real red, and she can't open her eye, it hurts so much. So what's the best way to take her vision? She says she can't see anything. The best way to start is to get her a numbing drop. And out of the Pyxis system, you can order up proparacaine or alkane and just give them a numbing drop. They're going to have a lot better time being able to perform the vision test if you numb their eye up. So please give them this. After you take their vision on the wall chart, obviously doing it one eye at a time, I like to kind of cover the eye and make sure they're looking through their palm to make sure they're not looking through their fingers like that. People have a tendency to peek through their fingers. If their vision doesn't measure very good, let's say it's 10/20, 10/30, we really would like you to use this pinhole device then, and these should be scattered around the emergency room or maybe in every room, hopefully. But they look through the little holes on this device, and amazingly, a lot of people's vision gets much better. So instead of reading the 10/30 line, maybe now they're going to be able to read the 10/20 line or even the 10/10 line when they look through that device. So if their vision doesn't measure good, repeat the test looking through this device. It's very, very helpful in determining the seriousness of their eye problem. Now let's say Nora here, covering one eye, can't see anything. She can't even see the big E on the top of the chart. What do we do then? Well, then we go to the next step of vision, which is to see if she can just count fingers. So either with her hand on there, or even I'll do it with my hand now. Cover her eye really well, and just see if she can see your fingers move, and kind of move them around a little bit, and maybe do it a few different times to get a feeling as to that they're getting accurate, consistent measurements. If they can't even see your fingers count, then you do hand movements. So cover their eye really good and just kind of slowly move your hand back and forth and ask them, are you moving up and down or side to side? Is my hand moving up and down or side to side? And do it a couple times until you get a good consistent response. If they can't even see hands move, then the next thing to do is to grab a real bright light, probably off the wall here, and actually to probably darken the room a little bit. And cover one eye, and while it's on the brightest setting, just take the light on their eye and ask them if they can see the bright light or not. And you do have to try to trick them a little bit. So tell them, I'm going to shine a bright light in a minute here. You tell me when it goes onto your eye. And kind of pause just a little bit, make sure they're not kind of guessing, and then kind of bring the light over them, making sure their other eye won't be able to see your movement of your hand moving. Another common scenario is the patient who says, I can't see anything, or there's a lot of blood around the eye, there's a real significant injury, and you're having a real hard time getting a good vision on the patient. I'd really encourage you to rise to the occasion. That's probably the patient who most importantly needs an accurate vision on them. So you might need to get some other coworkers in to help maybe open the eyelids up because things are so swollen. You might need a numbing drop in the eye. If they can't sit up like this and read the wall chart, obviously a near card is helpful. Again, one eye at a time, seeing if they can just read the near card. Maybe they're supine in the bed. But you're going to need a lot of help, and those most difficult patients are the most important ones to be successful with. The other way you can use the pinhole occluder is if someone has broken glasses, or maybe they're a contact lens wearer. Take the example of maybe a young patient slept in their contact lens, their eyes real red and painful, and they took their contact lens out. Well, they're not going to be able to see the distance chart probably very well because they're nearsighted. That's why they wear their contacts, but their contact is out. So you either need to take their vision at a near card, and they'll probably do very well. This is the young patient. Or you can have them look at the distance chart through the pinhole, or maybe even both, and they'll actually probably be able to see the distance chart pretty well through the pinhole without their glasses on. A similar scenario, but actually kind of the opposite, is the elderly patient. Maybe grandpa was walking, fell over the curb, and he hits his head on the sidewalk. He comes in, he's got real swollen face and things. And maybe he's reclined in the bed, he's got a C-spine collar on, and his glasses are broken. You're trying to take his vision but he can't see the distance chart. His glasses are broken, so he has a hard time reading. People over the age of 40 have a hard time reading up close. So, but you're still going to need to do it on a hand card because maybe he's supine. So then he needs to look through the pinholes and see if he can see the near card. So again, the pinhole card is very, very important to use. We hope this has been useful for you in helping our patients in the emergency room.